Smith. It's your granddaughter, Marissa. I see you joined that yarn club for the community we were talking about.
Yeah, I'm really loving it, but my hands are just not cooperating today. They really hurt. I should probably take one of my pain pills. I think my pain pill is one of these white ones.
Well, hold on a second. I love that you're using a pill box to manage your medication, but we're missing a few important steps, like the medication label, your name, the dose, and the instruction. Let's talk to the San Diego City College nursing students to find out about safe pain management practices.
Hi, we're students at the San Diego City College Nursing Education Program. My name is Marissa Mack.
I'm Lauren Yakuta.
I'm J-Lo Molina.
I'm Yumi Kramer.
And we're here to talk to you today about pain management. Pain is an unpleasant physical sensation alerting your body to potential or actual harm such as injury or illness. At least 36% of adults 65 years or older experience chronic pain, and many experience acute pain on top of that. Pain develops differently for everyone depending on underlying conditions and lifestyle choices. Pain is the primary reason people seek health care and one of the most common reasons for post-surgical hospital readmission. For example, the UCSD La Jolla Emergency Department sees over 30,000 people alone every year, and many of those patients experience some sort of pain. Many of us experience pain. There's different types of pain. Acute pain usually happens after a sudden injury like a fall or illness like the flu. It usually goes away once the underlying cause is treated. There's also chronic pain. This pain lasts longer than 3 months. It may come and go and requires more comprehensive long-term treatment. Your healthcare team may ask you to rate your pain on a scale from 0 to 10 to help them figure out what's going on. 0 usually means no pain, and 10 usually means the worst pain possible. If you experience emergent pain, you must seek immediate medical attention. This includes any new severe pain, chest pain, sudden confusion, weakness or numbness, trouble speaking, shortness of breath, or uncontrolled bleeding. Call 911 if you experience any of these symptoms. Non-emergent pain should be communicated to your doctor, but is usually manageable and not life-threatening. If you start having new pain that wasn't there before, or if your pain starts to impact your daily activities, you must tell your doctor. If your pain treatments and medications stop working, or if you start having unusual symptoms like nausea, dizziness, or constipation, tell your doctor right away. Any sudden or severe pain, seek medical care immediately and call 911. I know no one likes to call 911 or go to the doctor, but the sooner you get treatment, the better the outcome.
Quiz. You are walking with your friend Jake. This morning, he woke up with a back pain that a bit worse than usual, but he can still walk and move around. Later that day, he suddenly began to feel chest pressure, shortness of breath, and start sweating heavily. What should Jake do next? A. Take over-the-counter pain medicine and wait to see if it's improved. B. Call his doctor in the morning to report the back pain. C. Call 911 or go to the emergency room immediately. D. Rest and monitor the symptom for the next few hours. For the answer is C. Call 911 or go to emergency room immediately.
So it's important to understand the physical changes that our body goes through as we age and how they can contribute to increased pain. Our joints change over time and can lead to arthritis. We can have a decline in muscle mass and strength, leading to stiffness and limited mobility, and overall just feeling more sensitive to chronic ongoing pain. We also need to pay attention to how our bodies process medications and the negative impacts that can have on our health. So let's look at some risk factors that can contribute to having pain. Injury, stress, and trauma, aging, as we just discussed, depression, anxiety, chronic illness, and just having lower activity levels, so a sedentary lifestyle. Let's talk about some negative outcomes that having pain can have on our life. When we experience pain, we don't feel well, we don't feel ourselves, so we're less likely to be able to participate in our daily activities. It can impact our mobility and our independence and ability to move around as we desire, and it can cause some social isolation. If we're not able to do the things we want to do, we might tend to stay home to prevent that pain. Additionally, having pain can contribute to hospitalizations because of side effects of the pain, medication interactions, and just not enough understanding of how to properly take your medications.
It's really important for us to use safe medication practice every day by using a pill box if needed. Take medication only as prescribed and make sure that you understand everything you take. Make sure your physician know all about medication you take, even over the counter like Tums. At home, use safety equipment like grab bar, remove area rug, and have a good lighting to prevent fall. Finally, use your walker, crane, glasses, and any other assistive device as needed.
We can utilize community resources to improve our medication safety practices and improve our daily life. San Diego County Aging and Independent Services provide free fitness classes and educational courses regarding pain management and injury prevention. Senior centers also offer help with medication management and reconciliation. These care centers and our local hospitals use Healthy People 2030 by implementing their objectives to improve community health, including pain management. Please reach out if you're interested in further details.
Quiz time. If you have chronic osteoarthritis and are taking multiple pain medications, what is a safe practice you can do to help manage pain while reduce the risk of injury and hospitalization? A. Review all your medication with your pharmacist or doctor. B. Increase your pain medications if the pain gets worse. C. Avoid physical activity to avoid worsening pain and injury. D. Do not report side effects or worsening symptoms as it is part of aging. For the answer is A. Review all your medication with your pharmacist or the doctor.
Medications can help relieve your pain. Tylenol and Advil are common over-the-counter medications to treat pain. Tylenol can be used for mild pain, but avoid using too much as it can be harmful to liver. Advil can help with pain and inflammation, but use with caution as this can be harmful to your stomach and your kidneys. Discuss with your provider before taking over-the-counter medications to ensure it is safe for you to use and does not interact with your other medications or conditions. Other than taking medications, here are some ways you can relieve pain naturally. Relieve pain by calming your body through breathing exercises such as diaphragmatic breathing, deep breathing, and as well as relaxation techniques including meditation, mindfulness, yoga, and music therapy. These can help reduce pain sensation, lower blood pressure, and reduce heart rate associated with pain. Physical activity can also help reduce pain. You can do low-impact exercises like walking and stretching to reduce stiffness and boost your overall health. Home remedies include ice packs, warm compress, and massage therapy, which helps with soothing and relief. Make sure you are frequently moving and repositioning when at rest to improve your circulation. Think and reflect. Identify 2 non-pharmacological interventions that you can implement for pain management. It can be a method we discussed or an idea of your own. You may choose more than one. Pause this video if you need more time. So any answer is correct. Examples include deep breathing, meditation, yoga, music therapy, cold or heat therapy, and anything providing pain relief.
Now your pill box is clearly labeled with your name and medication, the dose, and instruction.
Yeah, now I'm really confident which one my Tylenol is. Thank you, Yumi. I learned a lot from you guys today.
You're welcome. Now
Please let us know if you have any questions. Remember to talk to your doctor if you have any questions or concern about your medication and pain management. Let's all keep working towards comfort and relief. Thank you for your time.
Thank you.